It's our great delight that you've joined us for our 4th ReAct annual conference that we have in collaboration with the South Center. This year is quite unique for us in that we have people from over 20 countries because when we started, there were very few countries. It was a small number of us that actually were convening, and now we can see that the interest and the momentum and the response is getting bigger and larger.
On behalf of the South Center, as an intergovernmental organization that works with developing countries and development issues and also on health issues, it's for us a pleasure to be able to be here and learn from the experiences of all the countries representative, but also particularly for Kenya and all the activities that have been happening here. So thank you.
The ReAct Africa Conference has become a very important meeting place for AMR. And this year also strengthened by the collaboration with South Center. We all know that a lot of positive things has happened just over the last few years. The Global Action Plan, the Political Declaration, and notably many or most countries in the world having a national action plan, or at least a plan under production. But having said that, we also face the crisis of AMR, which is becoming more and more visible, not the least hitting the low and middle income countries hardly. Also, what I think is missing, and the understanding is not fully developed, how the needs are and what are the real barriers in low income countries. We know that many action plans are there, but they are sitting still because there is no financial means, there is no capacity, no catalytic sort of funding to get forward. If we can get a clearer picture of the real needs on this, would be a very great input from your meeting. So I'm really sad that I can't participate in person, but I will clearly follow the deliberations of your meeting, and I think it's really important, and I wish you the best of luck. Thank you.
So it gives me great honor and pleasure to join you on this Monday morning as we congregate here at the start of a regional conference on combating antimicrobial resistance in Africa in the year 2018. We all have a role to play, and I challenge each and every one of us to do their part to preserve existing and new antimicrobials. I wish you fruitful deliberations over the next 2 days as we renew our pledges in fighting AMR. It is therefore my pleasure to declare this officially open. Asanteni sana, shukrani. Thank you for your kind attention.
I know from the last time that this is such an inspiring conference, and I really would like to pay tribute to ReAct and South Center. You are doing such a fantastic job. It's all about implementation in a good health system, and that's why the WHO will advocate universal health coverage, that we improve our healthcare systems, but because that's really important for controlling AMR.
OIE has been working with other intergovernmental organizations, including FAO, WHO, that is the famous tripartite, and have agreements on how to handle AMR. And the first one that came into force is the agreement on the Global Action Plan that was followed by specific activities within these international organizations to have strategic plans and action plans of their own.
Something worth noting from this conference is the link between the Sustainable Development Goals and how AMR affects the achievement of these goals. This is something that I believe most of the participants here will leave with a clear reflection of how to relate the activities undertaken in combating AMR and how they affect the achievement of the Sustainable Development Goals.
It's really important, and I've had discussions with many colleagues from ReAct, that civil society is properly engaged. A lot of the plans were pulled together in a hurry. A lot of ministries did a great job in, we have to have a plan, let's write it, let's go forward. But those plans have to have legs and become embedded in civil society, because so much of the implementation goes through you, but also you have that challenge function. You have, with the survey, many people say, it's a self-reported survey, how valid is it? I'm pretty confident that if civil society has really discussed it and challenged, that's by far the best accountability, really, and the best guarantee that this is good data and we know what is really happening. And I hope very much that you use it as such, and that there is this discussion and debate at country level before and after it's sent in.
The conference focused on governance is to have this discussion and really pick your brains about which are those spaces at the regional level that could be leveraged for building a better link then also to what is the global governance existing infrastructures. For example, of course, we all know that the WHO, FAO, and OIE have important regional focal points. So clearly that is one area to leverage, how to better work with those regional representation offices from these three core bodies. But then how do we integrate, for example, the UN Environment Agency better? As well, how can we leverage the other specific institutions, African institutions? I can think of, for example, NEPAD or others that you think perhaps might not already have a standing program in MAR, but that they would be very important as regional institutions to be better involved.
By volume, over 70% of antimicrobials are used in non-human applications, largely in the food production sector. So the need to curb antibiotic use for growth promotion and for preventative indications in agriculture is also critical. Drug-resistant infections, particularly in foodborne outbreaks, risk spreading from our food system to our healthcare delivery system. So what can drug regulatory agencies do to ensure that antibiotics are used appropriately for treating diseased animals so that we can conserve their effectiveness for both our healthcare delivery system and food production system? So we do have much work ahead if we are to ensure future generations a world free from the fear of untreatable infections. But there are a number of strategic entry points where we might make a catalytic difference through our regulatory system.
We want to have a common framework as Africa on how we begin combating AMR. I know we are from different contexts, but as a continent, we need to start looking at what are the common issues facing us as a continent and how do we begin addressing, especially when we start having global meetings. So that's why we're happy. So we're happy for ReAct and team for bringing us together and having this candid discussion.